Good morning everybody, how are you doing? Michelle McManus here. I'm one of the admins on Dystonia at TMJ Connection. It's approximately about 11:30 here in the morning. Now I don't know if you've seen some of the posts I've been putting up recently, but what we're planning to do is do a weekly video on here. Just quickly videos around about 15-20 minutes long, going through different subjects on dystonia and how it can be for many people related to their TMJ and jaw. So we're going to be covering different subjects. Now, if you're watching this live, please say hello to me. And if you're watching on the replay, also let us know. And if you do think of anything that you think we should actually cover in these videos, please let us know below, and any questions. Like I said, these videos are going to be quick videos covering each subject. Now, Dr. Jeffrey Brown has kindly said that he will come on each week and cover different subjects to help us out. So I'm actually going to invite him onto the live now, and before we talk to him, I'm going to actually go through what I found on the internet, what tells you what dystonia is. So we're going to go through that very quickly, and then I'm going to let it go over to Dr. Brown, and he's going to go through dystonia and how for a lot of people it can be related to the jaw and TMJ area. So let me add him now, bear me for one moment. I'm going to bring him onto camera. Add in. Okay. Let us know also where you're listening from. I know we've got people all around the globe, especially in the US. I'm from the UK, so I know it's very early where a lot of you are. So a lot of you will be watching this on replay. Okay, so we're connecting now. So good morning.
Hey, Michelle.
How are you?
Good morning. Doing okay. Thank you.
Good. You can hear me okay? I'm going to turn you up a little bit.
Yeah, ready to rock and roll.
Excellent. Okay. So like I just explained to everybody, this is going to be quick videos. I'm going to just quickly give some information, what I've got here from the internet, what's telling people what dystonia is. And then after that, if I can actually just let you take over and go through it with people. That's okay with you, Dr. Brown? Excellent. Okay, so like I said, if you go on to Google, basically, have a look at a good source I've got here. I'm just going to read out what it tells you what dystonia is. Now, it says cervical dystonia, also called spasmodic torticollis, is a painful condition in which your neck muscles contract involuntarily, cause on your head to tilt or turn to one side. Cervical dystonia can also cause your head to uncontrollably tilt forward or backwards. A rare disorder that can occur at any age, cervical dystonia most often occurs in middle-aged people, women more than men. Symptoms generally begin gradually, and they reach a point where they don't get worse. There is no cure for CD, cervical dystonia. The disorder sometimes resolves itself without treatment, but sustained remissions are uncommon. Injecting Botox in the affected muscles often reduces the signs and symptoms of cervical dystonia. Surgery may be appropriate in a few cases. Now, this site I got it from then also goes into the symptoms, the causes, risk factor, and complications. Now, it doesn't actually mention any medication, but I know also medication is very common for people in many countries to actually be prescribed medication as well. So that's from the source that I've got when I search for dystonia. But I just want to hand it over to you, Dr. Brown. If you can explain in sort of terms, easy terms, basic terms on what you see, what dystonia is for a lot of people, how it's related to the jaw and TMJ area, that would be brilliant. Thank you.
Sure. All right. In almost all cases that I have seen, in fact, in all cases, the discs that are inside the jaw joints are out of place. They're slipped. It's like saying you've got a slip disc in your lower back. Everybody totally understands the concept. Your legs hurt, your back hurts. It's just the way it is. very few understand the fact that there is indeed an articular disc, like a kneecap on the knee, inside that little joint right here. When that is out of place, it actually pinches blood vessels and nerves and can wreak havoc with the whole body. It's a really bad situation. In addition, when the discs are out of place, it directly correlates to C2 in the cervical spine. So if this is out of place, this is out of place. And I've seen it every single time with our cervical dystonia patients. The key for diagnosis, unfortunately, is an MRI, but it has to be done precisely right. I have a place I've used for 25 years now. They've done great MRIs for me, and I am so picky and OCD about it that I only allow one doctor over there to read for me. That's how difficult getting a great TMJ MRI can be. I've got a great example if you want to hear about it, Michelle. Okay. This gentleman came to see me he lives in Napa Valley, California. He came in about 7-8 months ago, and he will be posted on our Facebook site pretty soon. We did a video, so he allows me to use his name and his information, so it's all totally up and up. I met him, and he was literally like this, and he's shaking like this the whole time. Could not begin to function. For 25 years, he has suffered this. Well, unfortunately, he did an MRI at the University of California, and they found nothing wrong whatsoever.
Okay.
Yeah, it was a shame. So I looked at the video, actually the film was myself, and I found what's called lateral displacement, where the discs are slipped out to the sides. And luckily, I called the doctor that read it out there, and he didn't understand what lateral displacement meant. And mind you, this is a board-certified radiologist. So we had a good talk. He was very open. He listened. He learned. And he then wrote an addendum for me stating, yes, there's definitively lateral and anterior displacement. So this is the kind of difficulties we're having in documenting these cases. Number one, to get insurance to pay, well, you need documentation. But this patient ultimately, when I finally did get my eyes on the MRI, I realized, wow, this is bad. And he ended up having surgery to fix this. So Dr. Gregory, my surgeon, got the articular disc and went into the joint and did what he could do. Unfortunately, he found the left one was all in shards and pieces. It was severely damaged beyond repair. So imagine little pieces of cartilage sitting in your joint, poking blood vessels and nerves for 25 years. He was in a mess. Now, he came in, I think it was 2 weeks ago for suture removal, and he sat just like this with just that going on. That was it. Now, there's granted a lot of inflammation, a lot of swelling up in there, so it'll be many, many months before your system can calm down. But we have high hopes that we've gotten this gentleman maybe an 80% better life by actually doing the surgery to finally fix the damaged discs. So that's a typical dystonia patient that I see on pretty much every day. I see a dystonia patient or two. And a lot of them really need the surgery is what I'm seeing if they've been damaged for a long, long time. So, good example of what we see.
Thank you for explaining it a little more. You know, it's not something that people see when they Google online. You know, there's lots of different treatment. We're not saying that there is a lot of, I'm sure you agree, there is lots of different treatments for dystonia, and the main aim for people is to get their life back or to a point where they can function again. Whatever works for them is great. But going back to the information what I got from the site about dystonia, it doesn't mention obviously like anything like that, TMJ or anything on how that can help or anything. It always, when you Google, it's always mentioning Botox, and it also mentions medication. But what I do want to point out is none of the sites actually tell you what dystonia is, truly is. Now, it will say symptoms, it does. It say how it moves your body. Obviously, we're talking about cervical dystonia here. Dystonia is different parts of the body, so it's not just the neck area. But it'll tell you the symptoms, how what it does to you and the pain, but it doesn't, like, for example, if I could say, I don't know, if you broke a joint in your body or you're diagnosed with cancer or something like that, usually when you have tests done, they will be able to find a reason for the condition you have. But There's nowhere online or anything will actually tell you that you can't do an MRI, you can't do nothing, you can't actually see dystonia. Now, they do say that it's from a certain part of the brain, and what I would like to find out myself, actually, is I know one of the surgeries they do is DBS surgery, and I know that can actually reduce the kind of symptoms of dystonia, but I would like to find out what part of the brain that they do on that as such, and if that's anything connected to the treatment that we do as well, if that's the same part of the nerves, if the nerves that are being used are the same. So that's something we can maybe look at and discuss. But I just wanted this really, like we say, we want to keep these videos quite short so we can go into different subjects. But I just wanted this one to really be the first video explaining what dystonia is and the sort of basic information of how it can, for a lot of people, be related, like I said, to the jaw and the TMJ area.
Well, definitely it's all related, that's for sure. Now, the other factor that I find involved in almost all cases too, cranial bone imbalances. For example, if you look at me, you can see how my left ear is higher than my right. Every one of us is like this. I've done a bunch of lectures around the world, and oftentimes I'll put up faces on the screen and just show people, look at that face. For example, the Duchess of Windsor, no offense, is severely distorted. Her eyes are like this, her whole skull is twisted, and I show her picture and people go ooh and ah, and wow, she's royalty, yet they don't know what's going on. This is a big issue. If you're cranially distorted, that means the jaw bones are like this, they're not balanced, they're going to jam up the sockets hard and jam up into the discs. Again, back to the TMJ connection. So when you're like this, it pulls on the neck, so the cervical spine is out, all from a TMJ disorder. It's not that difficult once you start getting into it, but I think this is not unlike saying, look, you have fibromyalgia. I think that fibromyalgia is a blanket term for, I don't know what the heck is going on, so let's call it something. Similar, I think.
Yeah, it's they're not actually saying why you've got that condition, what's caused it. Makes total sense to me. Total sense.
And that's how it is, and deal with it. So we like to dig down into the information as best I can. Now, I don't win all the time. I'll be very honest with you. But 99% of the time, it is a TMJ disorder connected to the dystonia. Unfortunately, when I meet people like the guy from Napa Valley, it's been 25 years of damage. So we're not going to get the whole thing. Not at all. But if I get 80% better for him, he's got his life back, he can go to work, etc. That's what we're trying for.
Absolutely.
And unfortunately, most people meet me on the far back end of the disease when things are so damaged that it's really hard to fix.
Quick question. I don't want to go too off the topic, but when someone gets dystonia and they're told it's through medication, because I understand that's one form of dystonia, could that still possibly be connected to the TMJ jaw, or is that kind of something that could actually be separate?
I've been thinking about that a lot, Michelle, over the years. The medication does something to the brain itself, and I'm not quite sure what it does. I think there was an underlying TMJ disorder already, and it may become exacerbated by these medications. And there are a number of medications that apparently do cause dystonia, but they're so minimal on their percentages that I don't think that they're big players in the equation.
I think the way I see it is because the way modern day as such, the way the human race is now, we eat differently. You know, going back to many years ago, you know, we was eating raw vegetables, you know, and stuff like that, where it over the years and over the decades, you know, generations, now we have softer food, we've got more chemicals, everyday chemicals in our life. We can't take out all chemicals unless we move and, you know, do all that sort of things. But you're going to have that, and the body can adapt. The body can adapt to certain chemicals, to certain things. But where the progression has gone, we're eating differently, like I said, the way we're treating ourselves, the way we're on the computers, and the way everyday life is so different. This could be a reason why so many people have body issues, including TMJ. Would you agree with that?
Absolutely. I see it every day now, too. The thing, wearing the mask that we're supposed to wear all the time now, actually pulling on the ears, jamming up the condyles and the sockets. I think I had 3 or 4 patients in saying that these masks are killing me, and their TMJ is getting worse because of the pressure upon the jaw bones and condyles. So, kind of a common thing. Not to mention, just yesterday alone, 3 or 4 teachers, they're all complaining. They're hunched over the computer all day like this. They wonder why their neck hurts. Well, obviously. And all I can do is counsel them, saying every hour, get out there, walk around, move around, get some vitamin D going on your skin. And this has been a problem for generations now, that we're not getting vitamin D. That's another thing to look at, Michelle. Almost every single patient that walks into the store, I do a vitamin D analysis.
Okay.
D is not a vitamin. It is a sleep regulatory hormone. And every single time, except for 1 patient, I have found vitamin D deficiencies to the extreme. Now, the other big concern with the low D levels, you're far more likely to contract COVID, by the way. So pay attention to that right now. As all of us, especially with winter coming around, get your D levels checked, and if you're deficient, supplement.
Yeah, you've got to look after your body, haven't you? The place you live is the place you live, so for sure. But thank you so much. I think I can. I think you'll agree with me that, you know, as the years go on, more people are going to have issues, and I think they are, when it comes to your body and your joints and the way you are because of modern day life. So, is there anything else you'd like to add? So I just want to try and keep this.
Person has dystonia, try the stick test, see if that makes a difference. But if they're older and that disc is jammed and stuck, it will not make any difference. That's a key thing you have to remember. But at least it's worth a try. And if you can get an MRI of the jaw joints, that will help with the diagnostics.
Absolutely.
So these will help, perhaps.
Excellent. Thank you so much. And Dr. Brown just mentioned the stick test. We're actually going to cover a bit more into test you can have, you can do at home as well. Like Dr. Brown said, there is a stick test you can do at home to help you to see if this treatment could help you, although you will need to have proper tests done. But we're going to go into that a little bit more next week, I believe, about the tests to have done to find out. Like I said, this treatment could help you. So hopefully we'd like to see you join us next week. But thank you so much, Dr. Brown. And would you like to come on, is it Tuesday next week, same time? That sounds good with you. Excellent. Thank you, everybody, for joining us, and hopefully see you next week. Thank you. Goodbye for now.